But more importantly, I will focus on addiction, stigma, and the society. When we talk about addiction, we are talking about someone who does not have control over the use of a chemical substance. It is a compulsive behavior and very relapsing. It is referred to as a chronic relapsing medical condition. Although we do not see it as such, we see it as a criminal issue, but it is a health issue. And that is the purpose of this presentation. Drug abuse is a global health challenge. In Nigeria, the prevalence is very high. A study that was conducted in 2018 showed that about 14.3 million Nigerians use chemical substance, psychoactive substance, other than alcohol and tobacco. That's very huge. And about out of that figure, about 10.6 million Nigerians use cannabis, Igbo, Indian hemp, as we know the street names. And this is because cannabis is being cultivated in all parts of Nigeria, and it is accessible, it is cheap. Aside this, about 4.6 million Nigerians use opioids, prescription opioid, tramadol, while about 2.4 use cough syrup laced with codeine. This is to tell us that we have a huge problem on our hands. Also, out of this figure, we have 376,000 who are drug dependents, who have serious drug issues. These are the people we refer to as struggling with addiction. We do not call them addicts again because it's stigmatizing and it's discriminating. So we're talking about this addiction, and I'm going to use a name, a life to tell this story. I am Daniel, a third-year student in the university. I happened to come home one day to see my parents and my siblings, and we were sitting in the sitting room, chatting, and I felt thirsty. I entered the kitchen to pick some water. All of a sudden, I heard shouts, gunshots. My instinct told me not to go, so I hid behind the door at the kitchen. After some time, I realized that I didn't hear any noise again. Then I came out to the sitting room only to see my parents, my siblings, in the pool of their own blood. After 2 months after, I woke up on the hospital bed. Because from that moment that incident happened, I didn't know what happened next. And that was the beginning of my journey. The drugs that were administered to me when I was sick, I had to continue using them to be able to cope with life stresses. Is it my fault? It's not my fault. It now brings me to predisposing factors to drug use, that many of them are not within the control of the individual. Many of them are caused by the society. A child on the street that is roaming about the street, no care, no parental care. It's not his fault. He wasn't sent to school. And if he's introduced to drugs at that age, it's not his fault. What about those in deprived communities? Those in IDP camp who had to cope with the killing of their relations, husbands, wives, children. It's not their fault. What about these days when we send a 9-year-old child to school in the name of he's very smart, he's talented, he will do well, and he's get there, he's lured into drug by a 15-year-old boy. How will he say no? Apparently before he even left home, he never knew anything about drug. There was no education. There was no building of self-esteem. And we expect him, we judge him, we stigmatize him. Daniel finished from school, apparently. Before he finished from school, he was on the street when an NGO picked him and took me to a rehab center. And there, as I was sitting, a staff came and sat beside me. And for the first time in years, I had, "What is your name?" A name I had lost for years. No relations, no parents. In the course of using drugs, I had sold everything my parents left behind. I did not even continue school. I felt there was hope. I felt I had life. Because for years, nobody had ever asked me, "What is your name?" Rather, the society calls me junkie, cracked head, useless, waste, shameless. That is the name we give them because they are drug users. But we never bother to ask, what was it that led them to use drugs? We will never even bother to give a supporting hand. We will never bother to care for them to see if they will be well and contribute to developing the society. As God will have it, Daniel became well and was able to go through school with the help of an NGO. But there were other stigmas that were waiting for him out there. The moment he puts there that there was a gap in his educational history because as a result of drug use, or he was at a treatment center, nobody will give him a job. If I may ask all of us here, how many of us will give a treated drug user job in your organization? How many of us will give a treated drug user your boys' quarters to stay in? How many of us would employ a treated drug user to be our megad, our housekeeper, our cleaner? Nobody. But have you asked yourself one question? What if this individual is my daughter? What if it's my son? Wouldn't I want him to get a job? Wouldn't I want him to become responsible? Wouldn't I want him to get married? That is the question. The issue of stigma. Stigma is a stain. It is a mark that makes an individual unacceptable. It brings about prejudice. It brings about a lot of discrimination. And that is the essence. We must understand that anybody using drug has never said to me that he wants to continue using drug. I have never, in my course of 33 years on the job, for every drug user that I have met, he will say he wants to stop. Of course, it's a brain disease. Because when somebody takes drug, the first place that drug goes to is the brain. And that's why it's called a brain disease. It alters the way the brain functions. That's why somebody on a chemical substance will do things that he won't be able to do ordinarily. So we must stop stigma. We must stop discrimination against people who use drugs. We must show them compassion. We must show them understanding. We must support them to get better. Without your support, we cannot work. Because one of the predisposing factors to drug use is people who come from chaotic environments, chaotic families. It has been proven that one of the factors, contrary to the chaotic families, is a bonded family, which is a protective factor against drug use. So you can see that we need to give them, we need to be compassionate towards them. We need to support them. So what are we not doing? What is not working in our prevention efforts? We put more emphasis on punishments instead of care, instead of compassion, instead of support and reintegration, acceptance for the drug user. Then we must adopt evidence-based prevention interventions. There are prevention interventions that have been proven to be effective. For instance, early education, early intervention. We must start educating our child early enough, our children early enough. Because a child's brain stops developing at the age of 25. And if any chemical substance should tamper with his brain before the age of 25, it has devastating consequences. And that's why it's called relapsing from medical condition. Because the rate of relapsing is very, very high. We must adopt evidence-based prevention interventions like the harm reduction, which is the needle syringe program that is being implemented in Nigeria in 10 states of the Federation right now. We must support that so that drug users can live. Because the principle behind harm reduction is for them to live and not die. Community must be engaged. Active participation of the community. It should be a whole society approach. It's not an organizational thing. It is not something that should be left to only the leaders. It is something that all hands must be on deck. Then the youth themselves must also be engaged, including the drug user. We must have human-centered prevention. Human-centered means we must think about taking care of those who are already struggling with addiction. We cannot leave them and move as if nothing is happening. No, we have to take them along with us to build our societies. In conclusion, there are so many Daniels out there who are waiting to be asked, what is your name? Please let us ask them that question. Thank you very much.